So hi and welcome to this conversation with me, Prune Harris. I'm joined again today by Dr. Clare Willocks. Thank you, Clare. Clare is an amazing friend and also a doctor, a gynecologist, obstetrician, many various ways of holistic medicine you're also trained in, Clare. And today we're going to be talking about the menopause. Last time, if you caught that podcast previously, then that was about the perimenopause. But today we're going to be concentrating more on the perimause. So welcome, Clare. Thanks for being here.
Thank you, Prune.
Right, so let's dive in, because that place of the perimenopause, my goodness, it feels like the menopause that I've witnessed women go through holds so many variants in it. And I think that's one of the massive challenges, isn't it? When we're working with patients or clients working to actually help women through their menopause times. And the spectrum of what people can experience is so varied. And I wonder, Clare, if we can start off, if you can share some of the most common physical symptoms that people will experience or may experience, because of course that's the other thing. Many women can go through their entire menopause period time, and the only thing that they really see a change in their body is that their periods stop. So let's start with some of those lists of symptoms, so that for anyone listening or watching to this podcast, and actually they can begin to clock and track whether they are there already.
Well, thank you, Prune. One of the most common symptoms that people experience are what they call vasomotor symptoms, so the hot flushes, the sweats, and the States call them hot flashes. And that's really about a kind of a temperature instability. And they themselves can be really disturbing because they can affect people's sleep. They wake up drenched, they need to get up, and because you're very, very hot, but then the sweats cool you down, and can be quite disturbing. The next thing that people very commonly experience is they complain of vaginal dryness and just a discomfort with sex, and it's just that things just begin to change, and then also a lack of sex drive. This sounds like I'm just describing some of the negative things, but you did ask for symptoms. One of them I'm getting just now is
the positive things in a minute.
So as I'm talking to you just now, I'm having a little bit of a flush myself. So I just say that's a little bit of a blushing, and I'm feeling like I'm a teenager again. So, but it's very interesting because it's almost, people say it's the great taboo, and people never used to talk about it, and now everybody's talking about the menopause. So I think there's a much greater awareness about the menopause and what things women can expect to experience, or actually what things that they're going through we talked in the perimenopause about actually there was a lot of chaos and things up and down and just not knowing where you were, and rage, and just I don't know who I am anymore. And in the menopause, there can be a lot of that, and kind of holding on to it. I think it depends on your perimenopausal transition. But it's interesting now. I run a virtual menopause clinic. I see people holistically and in the NHS, and it's interesting seeing sometimes the routes that people have had to go through before they realise it's my menopause. Some women experience a premature menopause, and it may take years, because actually it might be a while before their periods stop. The menopause is a year since medically. The menopause is permanent cessation of your periods, but it's not. You're not given that badge until you've had 12 months without a period. But a lot of it is the brain fog, the mental confusion, not losing your keys, just not knowing where you are, just forgetting things. And it's the body's natural response to actually preparing us to do a little bit less in our lives and to focus on what it is that's really important. Bladder symptoms is the vagina, as you get vaginal dryness, it changes the pH in the vagina. You become more prone to bladder infections, and losing the kind of the natural lubrication in the vagina, in the vaginal area. So one of the things then that women who've had experienced discharge all their life, well, suddenly their discharge goes away. So that's a positive thing. Um, and but I would say a lot of it is because people maybe are started in antidepressants, or they even are sent to a psychiatrist and they're labelled with like just not coping with things. And actually, it's just been part of a natural transition, and understanding the symptoms in themselves can be very, very empowering. Because I think that one of the most frightening things is going, am I going mad? What's happened to me? I've got a family history of dementia, and then that trigger that kind of sends people on a kind of cycle of worry and fear, and probably doesn't it isn't helpful in the least.
Yeah.
I'm sure there are many other symptoms as well. I mean, there's joint pain and yeah, lots. But we're here to talk about the wonders of the menopause as well, and the release and the freedom of it. So
But Claire, I think what you're bringing forward is really, really important, because I think it's worth exploring this kind of underlying assumption that the menopause needs to be diagnosed, or it needs to be medically worked with. And in a way, it's a legacy, isn't it? It's a legacy of a time when women's health really wasn't part of the mainstream medical understanding. So I think for a start, let's feel big compassion about that. Let's actually, as a woman now, as a woman going through the perimenopause for myself right now, then one of my big basis of my entire life is no shame, no blame ever. And I certainly don't blame the medical situation for the last 10, 20, 30, 40, 50 years. There was an underlying assumption there that just wasn't working for women. And it is delightful. I designed a menopause program 3 years ago, and actually the huge transformation in awareness around the menopause just in those 3 years, absolutely phenomenal. When I was creating and writing and filming that then, I was really having to kind of push edges of awareness. Now it feels like the awarenesses of not just the symptoms, the fact that women are transitioning, but actually a reclaiming of the power of the menopause is much more in everybody's minds. We're beginning to hold it in a whole different way. And of course, for me, one of the things that's exciting about that is that when we hold that transition time, it gives us the potential to honor the elder years as well, rather than it being perceived that women, once they stop being fertile or attractive, whatever that means to mainstream culture, then they're worthless. Actually, I've always held the belief that post-menopausal women will be the absolute changers of the world, because they have the power, the insight, the energy, the focus, and the big heart that really needs to come into all of the changes that we need to see in the world. And let me say very clearly, I'm not discounting men from that. Our male elders are also holding amazing roles for us, but they're slightly different. And it's beautiful to now see people holding that awareness of menopause as something that needs supported. And I think that's, when I was listening to you then, that's what really came forward. Now we have the capacity in our culture, in our families, in our communities, to really support each other, to support women, to openly talk about the menopause. So that's an exciting move forward.
well, I was so grateful that you created that course in My Dependent Menopause, because, as you say, there wasn't much to offer to women. I had trained in homeopathy, and for many years had been offering that, but many that wasn't necessarily the solution for everybody, and people are wanting to really choose for themselves what's the right route for them. Some women, for them, HRT has been the it's been the best thing for them. Other women find that actually hormones, just if they've taken hormones before, they really didn't. It just is not what they want to go down, and they want to find other ways to support themselves. But actually having that course that I could refer people to, and that's not just within the NHS, but I was seeing energy medicine clients and saying, actually, these are some tools that you can find to try and help, to help empower yourself, and then from that place, then feel that you've got this, decisions that you can make, which, and the decision is the right one for yourself.
Yeah, absolutely. In the process right now, as you know, of relaunching that course. And this time I'm really working with the perimenopause understandings and the years after the menopause, because that's a little place that I feel we can have more discussion about in our modern culture, that once the menopause is over, then actually, wow, what is for me when I look at older women who are empowered, and that's a really, really key difference. Some women, as they've gone through their menopause years, because they haven't been supported, because they haven't been able, and when I say supported, I don't just mean supported by other people, I mean them having the tools to support themselves. Um, Both of them absolutely vital when you're working with hormones, because they change every second, don't they? That's what's so challenging about hormones. So it's really beautiful when I look at older women who have gone through or are almost completing the menopause. At that stage, their energy system is exquisite. It has a fineness to it. It vibrates with a fineness that is, it's much more akin to the energy that we find in the energetic core, in that soul essence, because a lot of the, how do we say this? As people, as young women, as we grow, we're filled with the shoulds of society, aren't we? Men as well, but I'm here, we're talking about menopause, so I'm going to be talking about women. Um, we're filled with the shoulds. We should do this, we should do that, we should be a great cook, we should be great at sex, we should. And part of our becoming is about meeting those places, isn't it? But when we get through that menopause, often as we're going through it, then actually all of those shoulds begin to be shrugged off us. We begin to actually have so much more connection with who we are inside, in that real deep authenticity. And so older women, as they've gone through the menopause, their energy systems change into carrying more of this soul wisdom, or actually the words I often use for it is the wild wisdom, that wild wisdom that's untamed, that's not fettered by societal norms. It's actually about expressing that immense authenticity of the soul. So it's wonderful that we get this chance now to actually explore and move us more and more into that place of that wild wisdom. And Claire, you talked about HRT, and I'd really love to pick that up a little bit more, because it's wonderful that there are so many ways that women can be supported and support themselves. So maybe let's explore that a little bit. Let's start with HRT and then talk about some of the other ways that we can support ourselves.
Well, I'm old enough now that I lived through the pill scare in the 1980s, and then they had the HRT scare, and it was at a time that, almost there was a talk about, oh, everybody should be on HRT. There was all these debates about everybody being on it. Then suddenly nobody was on it, because they did this big study with the Women's Health Initiative, and it was over 20 years ago now. But the study was, they were looking at women in their mid-50s and their 60s, and they were on a particular type of HRT called Premarin, which was horse urine. And these horses were basically bred to they were pregnant mares. It was pregnant mare urine, and there was a huge amount of, you think of the pain and suffering within these horses' lives. But these women were given HRT at an age that they were already at a risk, a higher risk of breast cancer, higher risk of heart attacks, and suddenly they pulled the study. So the result of that was that nobody went on HRT, and it was, it wasn't a good study. Nobody went on it. And there has been, HRT was a massive, from a pharmaceutical agency point of view, it was a massive money spender, a money spinner. And way back in the heydays of, that they were just, the drug companies spent massive amounts of money trying to promote it. And then it suddenly became nobody was on HRT. And probably it's just been in the past, not even, I was going to say 5 to 10 years, but probably not even 5 years, that things have completely changed around. And that's because if just more awareness, I think there's been well, it's been more awareness, but more just, I think there's probably been more authenticity as far as the scientific data is concerned, if I'm going to say it as clearly as I can. But there are different options of HRT. So people tend to think of HRT, well, it's Premarin, that's from a pregnant mare, or it's a synthetic hormone that I need to take, and synthetic hormone, I know I didn't cope well with the pill, or I've got risk factors, or I've got a family, a family story of breast cancer, I absolutely can't have HRT. But there's now different types. A type of HRT is a vaginal estrogen, which you could either take as a ring or use as a tablet or use as a cream. And that can make a huge, big difference to women, because they may not have all the hot flushes and sweats and a lot of the emotional things, but it could be just a physical issue. They keep getting urine infections and it's really difficult, or they've got vaginal dryness, or they've just got discomfort and it's really not very, it's not comfortable, and it makes a huge, big difference to them, and also from a sexual point of view as well. Then HRT itself can be either by tablet, that's orally, or by a patch, or by gel. So I think there's so much more choice now for women. It depends whether you have got a womb or not. And usually, if you don't have a womb, it's been surgically removed. And if your womb has been surgically removed, because in the past 20 years, well, it just wasn't discussed. HRT wasn't discussed, and I think women can get this just sudden, absolute, awful menopause, and it doesn't even come into the post-operative discussion. Doesn't even in the short time with surgical advances, you can get home that day, or you can get home the next day after a hysterectomy. Whereas beforehand, you were looked after and stayed for a week, 2 weeks, and I'm not necessarily saying that was a good thing, because you developed a blood clot in your legs or something else happened. But it's now there's a lot, many more options and much more awareness. So HRT is considered medically, it's considered pretty well essential if you've had a premature menopause, unless you have strong risk factors, up until the age of 50. That's seen as a kind of a natural replacement. And then beyond that, so in the past probably 5-10 years, we would have been saying, well, you just need to take short duration only, 5 years. And women would take it for 5 years, then stop, and they had to go cold turkey. And now I think that there's much, much more safety as far as, if you've had a previous blood clot, well, you can take it. You can use a patch, you can use a gel, you can use it sparingly, or you can actually, if you are resourced enough, and you can actually resource more natural forms. So you can get natural progesterone, which is an HRT. Really, people can buy it over the internet. And I'm not saying that that you should be doing that, because this is really about having a discussion with your own healthcare provider. But you can get natural progesterone. But now, as well, within medical fields, within HRT, they're marketing it as body identical. So you can get body identical progesterone, body identical estriol, which is much more gentle on the body. I can't say it's necessarily with lower risk, with lower side effects, but it does have a gentler action on the body, and it's more of a kind of a mimicker of our body's hormones. And I know so many people say, "Oh my goodness me, I just didn't know." I took it, and it's like the lights have been switched back on again. I suddenly feel so much better. I feel, and I'm back to myself again. Others are like, well, actually, I just feel like I'm biding time, because as soon as I stop the HRT, well, my symptoms are all going to come back again. So I think a lot of it is, yes, everybody's different. Everybody's physicality is different. I think their physicality also depends on their genetics. What their mother's menopause was like. Did their mother go through a premature menopause? Do you have a history of, or history, of osteoporosis? What are your other risk factors? What about dementia? There's so much more to look into now, and saying there's a lot of protection from our own female hormones, and but it's not that we have a design fault. I mean, there's a gynaecologist that says, "Oh, we've got a design fault, and we should just have a zip, to open us up to have our babies," and ha ha ha, which I do find quite offensive. And I don't think the menopause is a fault at all. It's not that we have a lack of hormone. It's just that there's a recalibration of our endocrine system.
Yeah.
And we don't, it's not just all down into our pelvic area. It's just that, yeah, our power is, our power is shifting.
Yeah. So true. And I think often when we recognize the place of stress, nutrition, relaxation, exercise in all of the journey through perimenopause and through menopause, that still feels like there's a lot to discuss around that there's still the awareness that actually, because hormones move so quickly and because of the essential role of the adrenal glands in actually helping some of that shifting and moving, that there is a responsibility for each of us as we approach and move through menopause to ask questions about our lifestyle, isn't it? And that is so less trendy to talk about than finding that magic pill. But actually, when it comes to the subtlety and the speed of hormones and the speed of their changes, for me, it's always seemed like the women who can actually just move and flex a bit with their hormones, there begins energetically and endocrinally to be much more space then within the body system. I'm thinking about even yesterday, I did quite a lot of work in the day, went for a great walk, came back and I felt a shift in my hormones, just felt a drop there. And there were still things that I needed to do in my day. And there was that case of like, okay, one, I recognized that I needed a bit of a gentler time. There was something that had just come out of balance in me. And then two, I recognized I had a choice. And that's the other big thing, isn't it? One, identify that something is happening. Two, identify that you have a choice and say, okay, so what am I going to do? Am I going to reach for the caffeine or reach for the sugar and just blast through this?
One of the things is that I think people find for themselves that the caffeine or the alcohol or the sugar is just only going to make them feel worse.
Absolutely. But it's still a false legacy, isn't it? That we hold the awareness that, well, in our 30s, the caffeine or the sugar got us through, or the big carbohydrate got us through. So we keep it as a pattern. And I couldn't agree more that actually it's awareness about those patterns. And actually what I did was I looked at what I needed to do and I thought, you know what? I could just go and lie on my bed for 20 minutes. I lay on the bed for 20 minutes. I did some energy exercises as I lay there. I relaxed, I breathed, I paid attention to myself and I observed, okay, 15 minutes in, I still hadn't kind of come back into balance. But by 18, 19 minutes, I thought, oh, I feel ready now. I feel ready to move on. And then went for the evening doing whatever I needed to do. So I was both fortunate that I could do that, but I've also paid attention to how my body is in order to be able to respond to that. Because honestly, I think it gets to the awareness, doesn't it? That if we don't take those quick checks, if we don't do those slight balancings through the day, then actually by the time you get to bed, you're completely stressed out. You've made your hormonal situation far more complex than it needs to be. And often you've spilled out into your relationships, whether that's with partners, kids, colleagues, and actually you're not feeling great. So there's a lot to be said about understanding how to just bring in those little corrections, those little alignments, not even a correction, but those alignments during the day.
I was in a call with a lovely group of women last night, and it ended up being a play in words, and we were talking about the time we've been together and, over this in a way, amazing time of the pandemic. And it was about having a bit of space and actually needing to create that space and needing to carve that space for something to emerge. But it was the space was changed to the word pace. And then it changed to the word peace. And it was like all three of them together. It's like, actually, that's what we really, it's been very easy for me. So I have kind of come through the other end. And I used to be, for years, I was very embarrassed about even saying what my age was because I always wanted to be younger than I was. And now we couldn't access hairdressers, and my hair changed colour, and it's all, but I do help it along, but it's been very much a kind of a claiming, saying, okay, I'm out and I'm proud and this is it. But it's been easy for me because I am generally somebody who would have just said, I think actually going through the perimenopause, I got to a stage, and you probably witnessed it. I was just saying yes to everything, and that wasn't that so long ago. Yes, 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 and it was a wonderful, like, I can do anything. I can claim this, and I can, I'm in my power. But actually, very soon you realise, no, you can't, because I don't have that physicality that I used to have. I don't have that energy. I can't push myself, and I'm delighted that I can't, but I cannot push myself to the degree that I used to. And although I said a switch goes on when people start HRT, well, a switch goes off for me. And it's like, okay, I've got to stop. No, bang, I've got to stop. So there is, you can't push past it. But then it's being able to then go from that yes, the yes has got to be a very critical yes to, is this really for me to do? Is this really for me to do? Can somebody else do this? And they might do it an awful lot better than me anyway. And what is aligned to, what is my aligned yes, and what can I say no to in a gentle, compassionate, firm way, and with clear boundaries. So it's another lifetime work in progress for me. But I do our physical energy is less, but there's a power that's kind of rising up from inside, as you say, for postmenopausal women to really speak, to voice their truth, and we're not hemorrhaging our power in other ways.
Yeah, so true. I love that wordplay. Remind me, space, pace, and then peace.
Peace, yeah.
Ah, beautiful. That's really, really great. One of the things I observe in that energy field, and you'll totally know this as a truth as well, Claire, is that the more space we have, you talked about the word emerging. I love that. And I tend to think of the fact that our energy systems are always in the process of supporting us in our own becoming. So that by the time we move through our life, we're more and more and more ourselves, our true selves, our real selves, our soul expression. And that the more space we have in our energy field, then actually we can move more and more into that creative space. And one of the things I finished writing a book a few months ago, and one of the things I really worked with in that book, I wanted to find a way to explain the shifts that can happen in an energy field depending on where we are in relationship to whatever's going on. So I've recognized that in every human being there is a functional energy field which keeps us active, keeps us alive, keeps us moving. And then there's the habitual energy field, and that habitual energy field is where the shoulds are, or the musts are. It's where we do things because we have to. It's not a conscious place. It's much more of that place of simply getting through the day. When we're on that hamster wheel of life, we don't have much of this third energy field, which is the creative energy field. And that creative energy field is where we do not only our physical creating, whether that's thinking, cooking, painting, designing courses, whatever it is, that big juicy creativity. Not only does that happen in that creative field, but it's also where our imagining happens, where we're able to kind of really tap into the world that's waiting to come into being. So we get this amazing play between who we are coming into being and how we can be in relationship with the world that is waiting to come into being. And right now, every man and woman alive is very aware that the structures, the societal patterns, the way of working with the environment, the animal world, the natural world that we're currently engaged in needs to change. So the way I see that is that that is already in motion in this imaginal realm, in this imaginal space. And each of us, the more we can align to that, then the more in this creative way, we can bring forward these amazing realities that we want our children to inherit, that we want to experience ourselves. And if there's one thing I see impact that creative realm more than anything, is hormones. So stress hormones will snap that creative energy out of our energy fields, push us into the habitual, push us even further into the functional. Well, when hormones are balanced, then actually what they do, and especially at times of thick hormones, and often when you go through menopause, of course, you have this real electrical thickness in your system. And when that electrical thickness is there, it's one of the times that we can be most grounded, most creative. We can feel more detached from rationality because we are in that immense creative space. So that for me is one of the big benefits and empowerers of being able to align during the perimenopause and the menopause, because it is such a rich and creative time for us.
I definitely see the habitual as, I can't say the cause of all the suffering, because I know that it's so multifactorial, and there are some women experience menopause in a much more difficult way than others. But there is a resistance there, or a resistance to actually just simply being who you are or claiming who you are. And the more we are trying to kind of be who we want other people to see us as, or trying to please our boss, or trying to be, I'm not saying that, women, it's the most amazing book, actually. I'm just thinking it's about Women Rising Rooted, and it's almost the opposite of that. Then if we're going to try and say, well, we're as good as men and we can do this, and I've got to, I've got to get what I feel things, slipping through my fingers, and I'm losing them. I've got to hold on to them because this is just not fair. And the more we live in that, just is not fair, and I need to get fixed, then I think we, as you say, we're not claiming that power. We're not claiming that creativity. We're staying in a stuck place, and it ends up getting that cycle of stress. We talked last week about the hypothalamus and the pituitary, and then get caught up in this kind of feedback loop that actually something we need to let go of some things, because yes, we're not, maybe our bodies are changing, and things are not quite the same as they used to be. My boobs aren't quite at the level of my waist yet, but and there's lots of energy exercises that you can do to help with it. But yeah, the more I think we are in a fight against it, the resistance against it, or trying to be who we're not, in my experience of the women that I see that are really suffering, and I have to admit that the ones that come to within the NHS, the ones that come to the menopause clinics, are the ones that are wanting the fixes, are the ones that HRT is just not is not working for them, but they're more resistant to looking at, well, actually, my diet, my lifestyle, and it's not just about how much. I'm not saying that people should be going out and doing loads and loads of Zumba. It's about doing some gentle exercise, things like Tai Chi or Qigong, and actually really connecting with ourselves. So,
absolutely. For me, it's walking. I love walking. I feel that that's where I can move into that big creative space in myself. I'm often, as I'm walking, I'm really connecting with all of the energies around me, but I'm also connecting in deep and into that sort of imaginal realm. And I want to say as well to what you just said, Claire, we're right in the middle of changing paradigms here, aren't we? We're still working with that biomedical model that says we need fixing. This is a problem. And you're a doctor, you're an amazing doctor. Most doctors are amazing doctors, and they want to help you fix something. So it's this new stretch of holism coming into the mainstream, isn't it? To say, well, sure, we want to be healthy, we want to be vibrant, but maybe this isn't a problem. Maybe this isn't a fix in the personal. Maybe this is a problem in the cultural, that we're just all bringing awareness to, so that we can change it for ourselves and future generations.
I see that happening though, because I think it's amazing, because I'm seeing myself as only a very small in a medical capacity, see myself only a very very small answer, because there's now all the menopause at work the menopause at work policies, and that is focusing on much bigger, because people certainly in the NHS, they have a massive staff sickness rate, and a lot of it might be through to menopausal symptoms, menopausal changes, and there are women often antidepressants and just not coping, and actually it's not always HRT that's that is the answer for them. It's having some time to understand what's happening, having some time to address the losses that they've had in their lives. It might be, we said last time, it might be about their children leaving home, their relationships breaking up. Things are just changing in their lives, and I do feel that the culture is actually embracing that, saying, well, actually, we need to look at things like hydration. We need to look at what other things do we do apart from our work, and what gives us joy. And up until now, the medical community have been a little bit slow to really acknowledge that, because we are so trained to say we need to write on a prescription pad, this is what's going to help.
Absolutely. And also, you're also busy, aren't you? The challenge of actually you as a doctor moving into that creative space. My goodness, like
And that's another good thing about the past, and I say 2 years, that actually women and families and society have had to find other ways, because they can't get to see their doctor.
Yeah,
And
that's very true.
and also I had to menopause just wasn't as a gynaecologist, did you go to see somebody with menopause for the past 20 years? No. I spoke to my clinical director probably about 5 years ago about having a menopause clinic. That was not necessary. You wouldn't get anybody. Wow. Because you used to wouldn't fill the clinics because it's not a problem. And now there's been and I'm not a TV I'm not a TV fan myself, but I know there's been so much on on the telly and on lots of podcasts, and this it's amazing, but it's just taking that broader aspect. And saying that, the NHS do offer, I have just done the training on group CBT for the menopause. I had an ulterior motive for it, but yeah, it's great. Just not just looking at medical, as in popping a pill.
Well, I think that's a really beautiful way to end this conversation, in that place of really embracing that hope and potential in the future. And I think out of this discussion right now, Claire, the thing that I'm really, really holding on to is the way that women can support women, men can support women, having more conversations in the family can support women. I think of my own mum, as I was going through my teenage years, and I wasn't a very nice teenager. As I was going through those years, she was going through menopause in silence, and a beautiful woman, a very kind woman, a very, very gentle woman. And for her, it sucked away so much of her life force. And the fact that she was doing all of that unsupported is something that really, I feel that in my heart. And I'm delighted that here and now, at least conversations like this, at least all of the movement that's happening, means that all of us can support women and have a far greater awareness of what these perimenopause and menopause years entail. So really big thank you for your massive work in that area as well.
Thank you. Can I just say one thing?
Please.
When you said about men, so I think it's actually really supporting men, because men probably feel very, very confused, or or it could be female partners of a different age, but they feel very, very confused. They might feel that something's happened, that their partner doesn't love them anymore, that there's all this stuff happening, and actually to understand that this is normal, this is the natural phase of life, I think is hugely, hugely helpful. So we're all in this together, and if postmenopausal women are the future, well, come and join us and follow us.
Brilliant. Thanks so much, Claire, and I look forward to chatting with you again.
Thanks.
Bye-bye.
Bye-bye.